Well, that's a good question, because it is all-cause mortality is the metric we should be using to determine the safety and effectiveness of the jab. Because think about it this way: if COVID is as deadly and serious as claimed, and if the vaccine, the jab, is as safe and effective as claimed, then what we should be seeing is more people over a given period in each age group dying of any cause. Forget about whether it's COVID or non-COVID, because we've got all those problems about the classification. There should be more people dying from any cause if they're unvaccinated than if they're vaccinated, for the following reason. First of all, if it's deadly and the jab is safe, then those who are unjabbed are going to be supposedly getting COVID and dying, compared with those who are jabbed. So you should be seeing this big difference in mortality due to the COVID deaths, right? But on the other hand, if the jab is safe, right, it doesn't have any serious, isn't killing people through adverse events, then you shouldn't see much, you shouldn't be seeing any additional excess mortality in the jab compared with the unjabbed. So when you put those together, what you should be seeing is fewer people dying in the jab group than fewer people dying in the jab group than the unjabbed group in each age group over, let's say, some reasonable period of time that you want to look at this. So we're looking at like 6-month periods. Well, we're not seeing that. What we've done is we've of course looked at the Office of National Statistics data on this, and we've kind of like had problems with that, because superficially, when this data was first being released, it did look like it apparently was showing that the unjabbed were dying at a much higher rate than the jabbed, right? And it was showing in each age group as well. And this was, when we looked at this, we actually found that there was flaws in the data, right? What you were seeing was unnatural data. What we were finding was that when you looked at the non-COVID deaths, you were finding these massive, these spikes in mortality of those who were unjabbed at the very time that the vaccine rollout was happening for that age group. Now, why would the people who are not getting jabbed at the time when all the others are getting jabbed in that age group suddenly start dying of non-COVID causes? Well, of course, there is an explanation for this. There's a number of explanations for this. One that the ONS tried to say was, well, actually, it's something to do with they call it the sort of the healthy vaccinee effect, that it's only the healthy people who are getting vaccinated. So the unhealthy ones, the ones who are sort of about to die or close to death, we're not getting vaccinated, and so they're sort of dying at that time when the rest are getting vaccinated. Well, we showed both. We showed empirically and theoretically this wasn't true, because we know that empirically that actually even people close to death, for example, in care homes, these people were the highest risk people, the most critically ill people were prioritised for the jab in 2021. We know that, and even people who were in care homes and were sort of even those close to death were given it, because it was felt that they don't to avoid because COVID could be a horrible death. If you've got it, to avoid that sort of horrible death, it's better to be jabbed. So that was nonsensical. Theoretically, we showed when you looked at the data, it wasn't possible to get those peaks like that consistently in each of the age groups. And there was a much simpler explanation, and that simpler explanation was that people who were dying shortly after vaccination were being classified as unvaccinated deaths, and that was it. That's the explanation. Now, this shouldn't be a surprise for various reasons. For a start, it comes back to this definition of who is a COVID case, what is a vaccinated person, right? So, officially, for all of the studies on effectiveness of the vaccine, somebody who gets COVID within 14 days of being vaccinated is officially classified as unvaccinated, because they say, well, the vaccine hasn't had a chance to take effect yet. Now, there is some, you can sort of see some justification for that, but then you need to make allowances for the way you do the analysis of effectiveness, and they don't properly do that to take account of this. But the fact that all these people, in fact, just imagine that you had a vaccine which was just a placebo, right? Which had no effect whatsoever on those who got it or didn't. If you do that type of, and if there was some consistent rate of people getting some virus, then statistically, using that approach, that placebo will always be seen to be very highly effective. It's just because you're just not counting all the people, you're taking out all the people who've been vaccinated who get the jab and moving them into the unvaccinated category for those first 2 weeks after vaccination. Now, when it comes to deaths and vaccination, officially, of course, if you die shortly after a vaccination, it should be classified that you have had the jab, right? But for exactly the same reasons, that they're trying to, for the same reasons why they're classifying a person as unvaccinated if they get COVID within that period, if they get the virus in that period. Similarly, they're classifying them as unvaccinated if they die. Now, the ONS, what the ONS say, and incidentally, this is routine we know that that is routine in many parts of the world. Now, to be fair, the Office for National Statistics, they say no. They say no. We do it from date of vaccination and date of death. So it doesn't matter if they died, even just 12 hours after the vaccination, that will be counted as that death will be counted as a vaccinated death. Well, it's all very well fine for them to say it, but they get the data from various different bits of the NHS and various different bits of the recording system of the NHS, and we know that the mistakes are happening elsewhere. They don't get the correct data. If someone dies shortly after vaccination, their death is going to certainly be recorded, but is their vaccination date going to be recorded accurately? Almost certainly not. So that's where these kinds of problems come in, and we've looked over the whole period when they've been releasing these reports, and it's clear that in 2021 especially, this was a big problem of misclassification, those deaths. If you adjust for that, if you make adjustments for that, then you find that there is no real difference in all-cause mortality. In fact, if we looked at the recent data, we don't trust any of it. It's so flawed. There are so many flaws in this data, not least because overall, where the overall mortality rates are just wrong compared with historical data. When you just look at non-COVID deaths, right, and compare them with the previous periods of non-COVID deaths, it's not right. They're lower in all age categories, which doesn't make sense, which suggests that they're missing, or we know they're missing a whole load of deaths, right? We know that they were missing a whole load of vaccinated deaths, right, in their data. And so once you take account for this, not only is there not this drop in all-cause mortality in the jab, but if anything, in certain age groups there might be an increase. We found that some of the younger age groups, the all-cause mortality actually may be higher in the jab than the unjabbed. So,
thanks for watching the Radical Health Rebel YouTube channel. If you enjoyed this video, please be sure to share with your friends and family, or share via your social media. Hit the like button, subscribe to the channel, and hit the bell icon to receive notifications of new video clips from the podcast. And if you want to watch the full episode, completely ad-free, plus premium content, and join the Radical Health Rebel Patreon community, head on over to the Radical Health Rebel Patreon channel at www.patreon.com/Radical Health Rebel. Thanks again for watching.